Hello and welcome. Welcome to HIM132 Reimbursement Methodology 2 Billing Regulations. So I am Dr. Shelley Safian. I am here to be your Sherpa, your coach. I am here to help you really understand what this is all about and how to do it because this is part of revenue cycle management. And remember, no matter where you are in the healthcare system, and by that I mean if you work in the healthcare system as a clinician, in administration, as a professional medical coding specialist, other places in health information management, I'm assuming you would like to get a paycheck. And without that revenue, without that money coming in, there is no money to give you your salary. Certainly no benefits raises, Yeah, okay, not. If it's not there, it's not there. And that's the important thing that we have to remember. And we're in charge of, we have our hand on the spigot, the money spigot. We do our jobs well, and that spigot opens and the money comes flooding into the organization. We do our job poorly, and the for sale sign goes out on the front door eventually. Okay, so that's wonderful. We have control over over the money, both legally and responsibly. But also, I want to remind you that you're also a customer. Now, you may not be a customer of the exact medical facility in which you work, but you are a customer of a healthcare facility at some point in your life. You got to go to a doctor, a clinic, a hospital. And that matters how this is all done properly by those professional reimbursement specialists. Because if that's not done properly, what happens? They shift the debt to the patient. And personal bankruptcies in the United States, the number one reason is medical debt. And that's not all on you, but it's a good portion on you. So that's why you're in these courses. And in this course, we're going to start helping you understand how to do this job correctly. Okay, so before we get started in the actual nitty gritty, I want to lay down some absolute rules. You probably know this already if this is not your first CCTC course online, but I like to remind everybody because, the brain sometimes skips a few cells. Okay, so first of all, you have only 2 absences per minute. An absence in an online class means you have submitted no gradable assignments during the entire week, Tuesday morning to the following Monday night. Okay? Now, I don't know why you would want to go to the trouble of applying and enrolling and going through all these courses only to be not here to get the knowledge, number one. And number two, the third absence, you're automatically withdrawn from the course. Okay, bye-bye. That's it. All right. So be here, be present, get the value for the money and the time and the energy that you're spending. Okay? Number two, you have one reopen, and that means, oops, I totally forgot we had this quiz last week, or toward the end of the course, well, I really didn't like the grade I got. Now, this is one reopen, not one chapter, not one segment, not one module, one graded item. Okay? You email me and I'll take care of it for you, give you that second chance. It's okay. Everybody's entitled to a second chance. But that's it. You know, you're preparing to work in healthcare, and you probably already know how serious this is. And just because we're on the administrative side of the building does not mean that we do not get involved in the life and death and quality of life for our patients. If we mess up, the patient may not be able to get the treatment that they need, or the treatment that they need paid by the third party payer, which is the right supposed to be. Okay? Oh, yeah, more about that later. All right. Each and every week, Monday night is your note. That is, you got 7 days to get the work done. Got to be completed and submitted no later than Monday night. Now, I recommend that you right now sit down, do a schedule, do a plan. Okay? When are you going to do your reading? When are you going to do your homework? Your you know, the quizzes, the way we're going to measure your learning in between going to work and soccer practice for your kids and all the 50 million thousand other things that you have to do. Okay? We all have 50 million thousand things to do. Plan it out, organize your week. So, you know, maybe on Tuesday you read the chapter, you do the readings, and Thursday you start the graded assignments until Sunday morning, okay? Or maybe it's Friday, Saturday, Sunday that you do your work. Okay. When I was in class online, I used to do a majority of my work Friday, Saturday, Sunday. It just worked out better with my job. But that's okay. That's why we give you 7 full days. Okay. It's your responsibility to live up to your obligations, and this is part of it. All right. Browser, use Chrome. I don't care what you use for the whole rest of your life, for the rest of your whatever you want to do. Use Bing, use Edge, use Firefox, whatever. When it comes to accessing Brightspace, D2L online for this course, use Chrome. Chrome will give you fewer frustrations and glitches. Now, if you like frustration and glitches, send me an email and I will arrange for lots of frustration for you. Okay? But I am a no frustration because it gets in the way of the learning, and that's why you're here. Okay? You are building a foundation of knowledge that your future employers require you to know. And with that said, final grade to pass this class, you need a 74.5% or higher. Higher is good. This is the bottom of the basement, okay? Now note, this is not 74.4. It is not 74.3. It is 74.5 or higher. So let's shoot for an 88 or a 93, okay? That would be cool, don't you think? Yeah. Okay. All right. Once you get into the class, you want to start here, and you're going to read all the things, and that's very, very important. It's very, very important because if you don't have the information, the instructions, it's going to cause you problems. It's going to cause you difficulties, okay? Now, I got to tell you, I understand. I am one of those people who, if nothing else works, then read the instructions. Okay? However, not in this case, because time is limited. Time in your life is limited. And I'm not talking about death, I'm talking about the 24 hours that you have in a day. And trust me when I tell you, I have been trying for decades to get more than 24 hours out of a day and more than 7 days out of a week. And to date, I have not yet been able to accomplish that. So we only have X amount of time and nothing is going to change that. So you got to work your coursework into a plan and do your best to stick by the plan. And yes, of course, stuff happens. Okay, stuff happens. It's all right. You have a team here. You have me, Dr. Safian. You have Ms. Johnson, who's the program director. You have you have lots of people here at CCTC who are standing by your side and behind you to support you, to help you. But you are the only one that can put all this information into your brain. Okay? Questions? I love them. Email me. You want to confirm something? You want to make sure that you're understanding something properly? You want clarity? Email me. I answer all emails within 24 hours. I promise. All right. So now that we're talking about life has its little monkey wrenches that it throws into things, what I want you to do today is create a contingency plan. What if you lose power or internet service? You're taking an online course. If you lose power at your house or your internet goes down, which trust me, I know about this. I'll wake up, I'll come in and I'll call Spectrum and go, you don't understand. I work on the internet. If I can't get on the internet, I can't do my job. If I can't do my job, I can't make any money. If I don't have any money, I can't pay my Spectrum bill. Oh, okay. That's only when I can get to talk to a human. All right. The point is I want you to make a contingency plan. If you lose power in your house or your neighborhood or your internet service goes down, I want you to write down now today what family, friends, neighbors can you go to use their power, their internet, their computer so you can get your work done. Okay? I want you to find where the local public library is because they have computers that you can use and find out write down when they're open, what days, what hours, so you can figure out how to work that into your schedule if you can't do things in the luxury of your home. Okay? If you have a laptop, you can take that laptop and go to a nearby McDonald's, Wendy's, Panera's. There are 100 different restaurants that'll let you buy a cup of coffee or a shake or a soda and sit there and use their free Wi-Fi. I want you to write that down now. So then, God forbid, there's an emergency, you already have the plan and you are ready to go. You know where to go. Okay? Now, the other part of your contingency plan is what if your computer dies? I mean, whether you're using a laptop or a desktop or even a tablet, um, these things happen. So again, what are you going to do? Which family, friends, or neighbors can you go to and use their computer? And then make sure you write down the address for CCTC and D2L because if you're anything like me, I already have it bookmarked. I just click. Honestly, if I couldn't just click, I have no idea how to get there. Okay? You got to write it down. I'm sorry, old-fashioned piece of paper. Or you could put it in your phone, as long as your phone's still working, on the notes page, okay? Or if there's a real problem that's going to take a bit of time, I want to tell you that there's a place called Aaron Rent-A-Center, and they have different names. They are companies in every area throughout the United States. They rent furniture. So it's for kind of people, their first apartment, they rent furniture. But now, over the last few years, they've started renting laptops also by the week. You can rent a laptop by the week. So while your computer is being fixed, or while you're saving up to buy a new one, whatever it might be, you can rent one because you've signed on for a 100% online class. And I'm sorry to say, but a computer is necessary, required. Okay. And last but not least, and least but not last, is you can always come to one of the CCTC campuses and use a computer at the computer lab. Okay, that's a great idea. So then what I want you to do is I want you to write down, I want you to call, and I want you to find out the days of the week and the hours that the computer lab is open at CCTC. So again, when the emergency strikes, when you drop your laptop and it breaks and you're like, oh my gosh, what am I going to do? You already have the answer to what are you going to do. And you don't have to worry about using an absence, and you don't have to worry about missing the important learning from that week. Okay? I want you to do this today, because those that plan ahead typically don't need the plan. But if you don't plan, you're going to find that you might be in a situation where you need the plan. And then you're going to go, why didn't I do the plan like Dr. Safian said? Oh! Okay. So, plan. How long could it take? We're talking 10, 15 minutes here. Okay? But trust me, it'll be worth it. All right, one more thing I want you to, this may already be linked in the course. I don't remember, but it's definitely worth repeating. The Centers for Medicare and Medicaid Services has created this glossary of health coverage and medical terms. It's a download PDF. It is excellent. They explain all of the terms like deductible and premium and everything so everybody could really understand. Cute little illustrations, really beneficial, and it's free, 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 no money down, no money at all. It's free, free, free. Free. And when we're talking about things that cost money, then free is definitely on the top of my list. Okay? Really, just download it, take a look at it, and put it somewhere. Maybe print it out, I don't know. Put it somewhere where you can access it, because it's really so incredibly beneficial for you to understand the true and legitimate definitions of these terms, especially when we're talking about reimbursement from the professional side, which is you. Okay? All right. One more little thing, I have a little treat for you, because reimbursement is all about money. Money, money, money. Made me think of this song from the movie Cabaret. It's a song called Money Makes the World Go Round with Liza Minnelli and Joel Grey. And the fact of the matter is you can all talk about national health care, you can talk about universal health care, you can talk about private or government health care. It doesn't matter. Money is necessary. And the reason, let's start with the number one reason why money is necessary is because you are not going through all this education, going to go through everything to apply and get a fabulous job, and then no paycheck. And that is not greed. That is life. You need that paycheck to buy food, to pay for your house, to pay for your car, to pay for going to the movies every now and then. So enjoy this real quick. Oh, it won't work. Okay, I think it'll work when you look at it. But the fact of the matter is it's very cute. And I just wanted to say money does make the world go round, and money makes healthcare possible. Money buys the equipment, money pays the rent. Yes, money pays for the doctors, the nurses, and the reimbursement specialists, and everybody else. So, money makes the world go around, the world go around, the world go around. Money makes the world go around. Any questions other than could you please stop singing? Yes, I will answer your questions. You email me and I will respond within 24 hours. I am in the course 7 days a week. Not 24 hours a day, but I'm in there 7 days a week. So whenever you send me your email, I will see it within 24 hours from when you send it. I will respond. And we can email back and forth, set up an appointment to talk on the phone. We can do Zoom. We can do FaceTime. I am here to support you. Even though you cannot see me, I am sitting here right by your side, eager to support your learning and your future success.